Good afternoon, class. This is Melissa Ernest with my week 4 SOAP note. Today, I have a patient with the initials of MK. It is a 48-year-old Caucasian female who comes into the clinic to go over her lab results, specifically her A1C. So she has a past medical history of diabetes. So we do monitor her A1C, and today she's just in to go over those results. Her past medical history does include diabetes type 2, hypertension, obstructive sleep apnea, polyneuropathy, and obesity. She does do an annual wellness exam. She does do her pap smear still. She has 2 dental exams a year, and she does do an annual eye exam. Past surgeries as a complication from her diabetes, she did have 2 toes amputated on the right foot in 2018. So her hospitalization does relate to that. She has no known drug allergies, no known environmental allergies. Current medications include Lasix, 40 milligrams PO daily, lisinopril, 12.5 milligrams PO daily, gabapentin, 100 milligrams PO daily, and metformin, 500 milligrams twice a day. For pertinent family history, her mother did have a history of obesity, diabetes. She did have a CVA, which caused further complications for her. Her father had BPH as well as lung cancer. Her maternal grandmother had diabetes and chronic kidney disease as well as hypertension. Grandfather had congestive heart failure and gout. Paternal grandmother suffered from some mental health disorders. Paternal grandfather had rheumatoid arthritis, hypothyroidism, and osteoporosis. And her brother currently suffers from obesity, hypertension, and tobacco use. So as I mentioned, this is a 48-year-old Caucasian female. She's currently married. She has been with her husband 25 years. They have 2 sons together. She did go to school and obtain her bachelor's degree in early childhood development. However, due to increased educational demands from the school education system, she has switched over to being a caregiver for an elderly couple in the community. Let's see. As far as physical activity, she does go to the local gym at least 5 times a week. She goes 2 to 3 hours each time. 1 to 2 hours each time, and she either does cardio or strength training. She follows a strict Mediterranean, mostly strict Mediterranean diet. She does say that she does cheat a little bit during the holidays and special occasions. So as far as subjective, she states that she feels good today. She hasn't had any weight change, no recent illness, no fever, chills, no other concerns. As I mentioned, she recently did have her eye exam with no significant changes, no oral changes, no changes to her teeth, no increase in cavities or anything like that. She denies any chest pain, any palpitations or shortness of breath. She denies any recent cough or inability to complete her activities of daily living. As I mentioned, she does have OSA, so she does use a CPAP at night, and she does tolerate that well. No GI concerns, no GU concerns for her. She hasn't noticed any changes to her musculoskeletal system, no inflammation of the joints or deformation of them, no changes to her skin, no recent rash or injury, no color change or moles have been noted. As far as her neurological aspect goes, she says she does feel that her polyneuropathy is increasing in severity. It's not increasing in where it's affecting her body, but she says that the gabapentin used to cover most of her pain throughout the day. However, now she's feeling some breakthrough pain that she does use Tylenol and ibuprofen for. She denies any depression or anxiety, and she denies any changes to her hair, skin, or nails, no heat or cold intolerance, and as I mentioned, no weight change. On the subjective aspect, her heart rate today was 87, blood pressure 142/87, temperature of 98.3 Fahrenheit, respirations of 22, O2 of 98% on room air. Her discomfort level right now is 3 out of 10. She is 5'6" at 201 pounds, putting her at a BMI of 32.1. So she did recently have a CBC, a CMP, a lipid, a vitamin D, and an A1C done. Out of all of them, everything was within normal limits, except her glucose. It was 142, and her A1C level was still 7.9, which both are still elevated. Other than that, everything looked beautiful. On the physical exam, she was alert and oriented to 3. She made great eye contact. Her speech was great. She appeared well groomed. Her eyes, everything was within normal findings. Nothing was found on her ear, nose, or throat examination. Her oral cavity was beautiful. No concerns there. She does have some previous cavities. Her lungs were nice and clear bilaterally. No concerns there. She obviously is obese on assessing the abdominal area, but no masses were noted, no discoloration, bowel sounds were present. I wasn't able to palpate the liver or the kidneys at this time. I'm usually never able to palpate the kidneys, but the liver I'm sometimes able to, and I wasn't this time. So on her musculoskeletal exam, as I mentioned, her 2 toes on her right foot are missing. They've healed well, no concerns there. On integrity, or on her skin assessment, I did notice when I was examining her feet and doing the sensation examination that there was a wound to the left heel. She was unaware of having this. It wasn't purulent. There was no drainage. It did have a dried scab, but there was tissue loss at this time, but no current infection, it looked like. So my differential diagnoses all include diabetes. There was diabetes with polyneuropathy, type 2 diabetes with foot ulceration, and type 2 diabetes without complication. At this time, we're focusing on the foot wound. So diagnostic-wise, there is no drainage. If there does become drainage, we can do a wound culture on it, but right now it's not indicated. It doesn't appear that it is infected at this time. So we're going to make her a consult to the wound clinic and have them monitor it for her. And if there is any further development of infection, then we will treat it with antibiotics, possibly in the future need some imaging on it if it doesn't heal properly. Education will relate to daily skincare. She needs to be looking at the bottom of her feet. She already has one amputation. She doesn't need a second one, so we'll be heavily educating her on that. We want her to follow up in 2 weeks to see if the wound care has been scheduled and if it's working for her, and monitor the wound care. As far as the polyneuropathy goes, we are going to increase her gabapentin to 150 milligrams PO 3 times daily. We do want her to follow up in 1 month to determine if there's any changes there. I think I got everything in. Unfortunately, I'm about 30 seconds over. Everybody have a great night. I'll see you guys soon. Bye.